Hi everyone, welcome back to XGate Dental. I'm Emmanuel Kadosh, and we are here to discuss new procedures in the field of dentistry. We will provide interesting new cases to exhibit how doctors use our products to solve complicated dental cases. So let's get started. Today we want to share a case where we had a patient with a bridge on a couple of implants, and the patient had 2 crowns on the teeth. The teeth with extensive caries, and you need to extract the teeth, as you can see. Those are the teeth that's beneath the crowns, and we change the teeth to a bridge with immediate loading. And the most important thing that we want to show is how we did that. And considering that we had to take all of these procedures, we extracted both of the teeth and added an implant on the first premolar area. Now in this case, because we have osseointegration implants, we can make a bridge on these 3 implants, and we can use the new implant for immediate loading. In regular cases, it's not recommended to use 1 implant for immediate loading because there are a lot of extensive forces that go on this implant, and it can harm the process of the osseointegration. So when you already have 2 osseointegrated implants and you just add in 1 more implant to them, you can reduce the height of the crowns on these implants, and the forces on the implants will be a little bit smaller. Thanks to the height of the crowns, this is the bridge that we had before the 2 implants and the bridge on the 2 osseointegrated implants. We've added 1 more implant with a healing cap, and what we want to do now is we want to immediately load this implant and those 2 implants with the bridge. We want to make them 1 bridge, and this way we can immediately load the new implant. 1 unit, 1 bridge. This is the new bridge that was done. You can see the small screw channels. You can see how small the screw channels actually are. Here you have 5 unit bridges on 3 implants. You have very small screw channels, so the bridge is very strong. In immediate loading, the most important part is you need the bridge to hold 3 to 4 months because the most fragile part of the implant is in those 3 to 4 months. When you immediately load an implant, you need the implant to be restored perfectly for 3 months. After 3 months, you can remove the bridge, you can change it, you can do whatever you want. It's not recommended to remove the bridge before because you can remove it with the implant. So if the bridge will break down between those 2 implants, you'll have a problem because one of the implants is not osseointegrated and you don't know how many forces will be applied on this implant and how long it will hold. In many cases, we'll just reject and they'll stay with the 2 implants. This is the PMMA bridge that we saw. We have a plastic pin that will close the holes, and the bridge has a much stronger material to be as strong as possible. And this bridge, the 2 premolars, we made a little smaller because we don't want more forces to be applied on the newly added implant. The occlusion part of the crown is made smaller. The crown height is a little bit smaller as well in order to take pressure off of those crowns. So for the next 2 to 3 months, less pressure will be on this implant. And the probability that you will osseointegrate and everything will be fine is much higher. This is the final restoration. You can see from the zirconia with the glaze. You can see that the gingival is without glaze at all because this is the part where you don't have to have a plaque accumulation. So this part will be from zirconia. And this part will be as polished as possible so you can see the color of the glaze and you can see the crowns look very nice. The color is amazing and it was all done in our clinic. We closed the screw channels, we created a bridge, 3 implants, and 5 crowns. Thank you everyone that joined in to learn some new and interesting information. Make sure to stay tuned for more, and of course, don't forget to subscribe, like, and follow. Thank you, and see you next time.